Okay. Okay, we're gonna talk about the eCRF specifications and nothing but edit check specifications. You all can hear me loud and clear, right? Yes, you all can hear me clear, right? Okay, good. Good. Last time I asked you people to read something. Have you read like what is edit check? Have you all understood? I mean, have you all came to some understanding of it? Yes, no, come on. I need to talk. Okay, I'll tell you my real experience. Um, like where I just recently faced. I'll just take a minute. I just recently moved to Australia for a couple of months, and I've attended some of interviews. Like it's very big interviews, like any very bigger roles actually, like senior manager level. Okay, so when I attend these interviews, I thought like they want to take me through ask me questions related to the role that a job that I'm going to take in, and something related to um, uh, the leadership and how I handle the people, the manager level things. But when I attended the interview, my goodness, it was totally different. Not even one question about theoretical, like about the job, not even one question about leadership or anything. Initially, I thought they asked questions about how I handle my stress or how I handle the stakeholders, like a principal investigators, CROs, sponsor companies, how I maintain the quality throughout this interview. They were just looking at my communication skills. They were looking at my how smart the answers were, and they were also focusing on that. How will I answer smartly with my theoretical answers? you know Indirectly, they ask my theoretical questions, not directly. Even why I felt so differently, because it's not because of I'm attending the something in new kind or something different, but it's because each people has a different perspective when it comes to the interviews. So this is a second interview I attended last week, where the manager was from India, but she is scheduled in Singapore. So we spoke fine for 2 minutes. First 2 minutes it was good. Like she said she was from Bangalore. I said I was there. I studied in med school, and it was all good. Suddenly, I didn't know what happened in the interview. She just tried to complete the interview for just 30 minutes, and I was trying to answer, but she was not listening my answers. She was like, okay, do you know this, do you know this? She was taking all notes of it. And last time she mentioned we got so many applications for all over the world, from different countries. We got these applications and all. I was like, okay, you see that different perspective when it comes to the interview. You should know how to make them interest. You should know how to proactively answer. You should know how to take time before you answer something. You should know how to answer even when you do not have experience on something. But don't forget that you might get same kind of questions, not as the same kind of questions, but same kind of response they expect. Like, how confident you are. What is your skills in terms of being correct of something, or what is your skills in terms of sharing something or talking in a public? back then, IQVIA, when I was giving interview, they had this group interviews. That means first aptitude test. Like there was, I'll tell you this one. So there was a role for a clinical data coordinator for data management. So 400 people went for some roles, some 2 3 roles. That's all. 400 people, and 100 people been rejected in aptitude test. I cleared. Then there was a interview with the group interview. Sorry, there was a group interview. So all 300 people, I think, divided into some 10 groups, and all the 10 groups were given one topic, and each group has to talk good, and HR interview will assess that which group has done good, and they will pick one person or two persons or three persons from each group. Imagine. So that means they're trying to pick only 30 people or 10 to 30 people out of 300 people. You see that? That means you need to talk, you have to face the interviewers, you need to impress the team, you need to impress the others, and you need to highlight within your team. It's all it. Then there used to be HR round, then manager round last. The HR round, like just to assess like what kind of qualifications, everything. See that how competitive it used to be. It's same as now. The reason that I'm giving you questions not because that you're gonna read something, but also that I'm looking forward for some answers that you're gonna unmute and talk, and that makes you confident. Trust me, when I before it's been many years that I'm teaching classes, and before I was teaching classes I was like so tensed. Actually, there was one time I was teaching, I was giving some sessions to my office mates. I was so tensed I switched off my laptop because I couldn't talk. But later I just started taking sessions. I've experienced the confidence. you know that's what I'm trying to tell you, people. You have no idea what interviews would expect. No, maybe not today, maybe tomorrow, or after 1 year, 2 years, you will attend an interview. Until unless you start your own business, but you will start a interview. You'll go for an interview. So it's all I'm giving heads up, and you'll thank me later for this heads up, because no matter which country you go, the hardship is same. Okay. Good. So let's talk about specifications. So again, I'm asking questions. Have you all read what I've asked for last week? And if yes, can you just tell me what was the first question? That's okay. You can unmute. No one is going to tell you anything. Should talk. Good. Okay. I am sharing my screen. Just tell me if you can see. You all can see it? This you can tell me. Ah, thank you. So, what is specifications? Answer me. What is specifications? Come on, guys. Talk. It's okay. Type it. Can't do anything. What is specifications? No, no, like specification, the special requirements. Am I right? The requirement that needs some special attention. Am I right? Or specification. Okay, the specification that tells you to do something, right? There's a lot of meanings. I need this specifically. So that means specifically, that means you're trying to specify something. Now, let me specify the same. Whenever you do the clinical trial, or let's say you're a doctor, when you go to get a patient, especially let's say patient come for came for fever. They don't go for all the tests. They'll go only for specific tests, like okay, like a malaria, dengue, or what are the other tests they can come for, because that's the need. I don't need to do some MRI scans because the patient got fever until unless there is some, you know, what you say, symptoms, right? So now, whenever I'm designing a case report form, remember carefully, whenever I am designing a case report form, I am supposed to follow the protocol. The protocol which is approved, already approved by. Okay, what is IRB IEC? Can someone tell me what is IRB IEC? Come on, guys. Are you even audible? What is IRB? What is IEC? Am I in the right session? Because the people is to answer here. Okay. Okay, what is IRB IEC? What is this angioprotein receptor blockers? Okay, whatever. What is IRB IEC? Okay, what they do? Their responsibilities. Simple. What is IRBC? What are the responsibilities? What they do? Come on. EC looks over ethical part in clinical trials. Okay, good, very good. In order to monitor research, very good. Okay, in order to look into the ethical part, what are the documents they will review? How will I know? Correct, right? How will I know that they are ethically conducting the clinical trial or not? So what I'm going to review, or what I'm supposed to review, being a IRB IEC? Come on, you all know answer. Protocol, informed consent form. Okay, very good. So now that means the protocol is the one which talks about everything about the clinical trial. So same way, once we get an approved by the IRB IEC at each every site, guys, remember, in every clinical trial site there is an IRB IEC committee who will meet, and take a decision whether to even start a clinical trial or not. They're going to review every document that we are producing at the site. Yes, someone said CRF. Why CRF? Because in order to ensure no no personal information being collected, right? That's how it is. Now, what are we doing here? We have evaluated. We are not just, we're not using the paper case report form. We are using the electronic case report form. So whenever you are using the electronic case report form, like for example, if I click on go to settings, I have a Bluetooth, I have Wi-Fi, a lot of options. When I click on the Wi-Fi, it takes me the hotspot and look. See, how did they programmed in such a way that if I click in this option, that will goes to other option because they have specifications. Okay, whenever you click, if you click on the settings, this option should display. If you click on this option, hotspot has to display. This is how they write. Same way, when I'm entering the patient data in a clinical data management, and if my protocol says that you should have a vital signs form, vital signs. When the in the within the vitals form, the vital signs, you'll have systolic, you have diastolic, you have temperatures, you have respiratory rate. Okay, four forms. That means if I click on that, four options should display. And if I click on the systolic blood pressure, I should be able to enter the data. And this is called the specifications, giving the details in writing on how case report form should be programmed. Now let's take an example here. So here I have a vital systolic blood pressure. So this test is being performed for visit 1, visit 2, visit 6. Okay, so now that means how do I know that I'm only performing during these visits? How do I know that the vital signs are being performed at visit 1, visit 2, and visit 6? Because that's what the protocol is using for. The protocol clearly says that what we do for each visit for the particular patient. Now, so what is this test cases? Test case means the data that I'm going to test, how this is can be programmed. Now, okay, take two example here. First, two example, systolic, diastolic. This till here, I'll tell you, till query missing text. Take note of it. Mention as you mentioned that edit. Okay. I'm not sure since no response. I'm not sure if you read, but this is important for you all guys because there might be question because whenever you go for the clinical data management interviews, the minimum expectations are that something beyond. Why? Because you're not going to the clinical research interviews. Whenever you go for the interviews for the data management, they expect you to know more of clinical research because that's not just basics, but that's about everything. Then next step would be the data management. That means you're going for the next ladder, right? That is the reason that whenever you go for interview, there will be advanced questions such as that. Okay, do you know what is edit check specification? Can you give me an example of it? Now, since you already written, now you have an idea. Now I'll explain what is that. So now there are pages. Pages means like the each test, each adverse event is a page. And the demographics. So all these are called pages. Now within a pages, there will be fields. So for example, you attend, they ask you to write your details. What like they ask to write your demographics. So when they ask you to write your demographics, you'll write your age, gender, ethnicity, race, everything you'll write. But you don't write about how much you studied and where did you study, what did you study. No, you'll not write it. That's what comes under education, right? Same way that whenever there is a page, there will be details under each page or other field. Field means each data point is called the field. So now within the vital signs, diastolic is one field, systolic is one field, temperature is one field. Under the demographics, if you see here, if you see field number 5, demographics, under demographics, age is one field. Under the demographics, date of birth is one field. This is called field. Demographics is the page, page, and date of birth is the field. Right? That's how it is. Now, whenever we see these details, now for which visits I'm entering, I have vital signs for visit 1, 2, 6. And so now let's look into that, the test cases. The test cases means the specification I have written. If systolic blood pressure is missing, that means uh, no data has been entered or the test is not done. Someone told you, okay, we have done the vital signs, but we forgot systolic blood pressure. Until unless someone come and tell you, you will not know. But when I'm entering the data, if I don't enter the data for the systolic, go and try to enter for the diastolic, it will not take. Why? Because there should be there should be data as a no visit done, no test done, or value has been missing, something and all we are supposed to put, right? So here we just keep missing data. So there should be query. In for example, you try to open your mobile, I mean with the passcode, and they said like you enter a password, but it didn't take because you entered a wrong password. You see, you have got an error. Please enter the right password. That is a query message. That is a query text. That means here, whenever I say that no data has been entered, the systolic blood pressure is missing. Please enter, or else please clarify why there is no data. See that these specifications are helping me that why the data has been missed. That's so cool because you cannot lie about the data. I cannot just leave it as a blank. Now, action query is a missing data check. This is how we do that. Same way. Now I'll just give you an example of demographics. In every clinical trial, we'll have one different kind of one main first inclusion criteria. You see that is the reason I've asked your people to read inclusion criteria and exclusion criteria. Inclusion criteria tells you something that where patient can be added. The criteria that helps you that patient can be added to the trial. Fine. So now inclusion criteria says in most of the trial, patient age should be between 30 to 60 years. That means patients who are less than 30, more than 60 are not allowed to participate in the trial. Okay, and that's what the thing. So now the next thing is that patient age should be between 18 to 60 years and should be male. So if you enter female, it will not take. Right? Or it will generate take query stating that data is not expected. Now, what is the demographics? So here you see that we are taking this for V1, visit 1. You know why? Because we are only perform this test at V1 because the patient demographics except weight, every test like age, gender, ethnicity, race, uh, date of birth, all will be correct at only once. So because those details will not change. Maybe age might change after a year, but it will stay same for a long time. Okay, that's how it is. Okay. So age is not between 18 to 20. Please review entries are clarified. See that? That's how it is. So how this like well written, or what kind of things that you need in order to write the specification. Now let me share my screen that how to write the specifications. Just give me 1 second. Guys, any questions so far? Okay, see. So this is the live eCRF specification example. This is how we write. Okay. Whenever you make modification in any document in a clinical trial, we will have a specifications of I mean, we'll have versions. And now you'll have to give the reason for change in the particular version. Okay, so now version number 1.0, that was the initial draft, and person name was Syed, and the date was 18 July 23. Since it was the first one, there won't be any changes. The version 2 was second draft, and it was within 12 days of the initial draft. So what they did is they've added the respiratory field. That means they've added a new field to the case report form. Again, third third draft after post-production change on 13 August, they added one tumor ECR for the specification. That means one of the tests been added. So now what are the forms they have? For any given test, how many forms for each visit they will have? They will write down all these tests. Okay, so where would I collect this information? You'll be collecting all this information from the protocol. The protocol inclusion criteria. The protocol says demographics to be collected. The protocol says that physical exams, viral adverse events, concomitant medications. Okay, someone tell me what is concomitant medications. Come on, you all need to know. Come on, guys. I want to hear what is the concomitant medication. Okay, fine. Okay, okay, I got something. To have more medication things are taking same time during the study. Okay, do you have any examples? We have any Form D or B Form, M Form? Any examples? Any examples? And what is the prohibited medications? Very good. Diabetes and yeah, correct. Okay, good. Like any specific requirement for the prohibited medications? Okay, good. I'll tell you why. So in most of the clinical trials, there will be um, there will be prohibited medications, and there will be concomitant medications details to be collected. So whenever we do the clinical trials, the prohibited medications, okay, so the prohibited medication is something that they don't allow in the particular trial to be taken by the patient. No, if any patient takes the particular assessment, particular medications, and if you try to enter in the system, it would take, but this data will be reviewed by the medical monitors. Now you say, sir, we can program. You said that only female patient needs to be allowed in the trial, and if I enter the male as a male, it will not let me enter. But if I enter the prohibited medications, which is something not allowed by the trial, how it will take? Because we cannot program every prohibited medication. No, understood? You cannot do everything with robots, right? But you always need a human beings, something to be done. Okay, for example, robots can clean the roads, robots can do the guard the house, or robot can do something, the mechanical work or some building something. But robots cannot understand the human psychology. Robots cannot understand something that, right or wrong, right? And then unless you specify it. Same way that you cannot program everything. There are few things which cannot be programmed. This is very tricky thing, because sometimes you get a question that, okay, can it be programmed or can it be done this? No, everything cannot be programmed. That is the reason that human intervention is needed. The reason I am saying here, because if you see here, I said a system generated query here. System generated query means whenever there is a issue for these data points, a system will raise a query. And rest of the things has to be reviewed by the human beings, nothing but clinical data management personnel. Okay, now take this one. If I don't know if I forget, the data can be reviewed by, take this. The data can be reviewed by system and CRA comma data management professional. I mean, nothing but data management team, and medical monitor and medical monitor team. So whatever the case report forms that cannot be programmed will be reviewed by the data management team, CRA team, and the medical monitor team. So what they review, and what are the different forms that they will be reviewing, and how do they review, will be in the upcoming sessions related to the queries. Now, these are the assessments. So these are the forms that we will be performing the eCRF specification. That means for whenever, let's say, let's talk about visit. So can it be applicable for visit one? Yes, visit one. This will be only visit one. Randomization, visit one, and this also goes for visit two, visit three, visit the four, visit five, visit six, visit seven, visit eight. That means the vital signs has to be done for all the 8 visits. That means I will have to program for all these 8 visits. Simple. So now adverse event, yes, again, we will be doing for every visit. Concomitant needs to be corrected in every visit. Now lab assessment Study medications only for 1, 3, on 5th visit, and 7th visit, and the 9th visit. That means here you don't have to give any specifications. You don't have to do, you don't need that page itself. So we'll not find that page to enter the data during visit 2 or during visit 4, during visit 6. And that's how the specification works. So, so whenever we do the clinical trial, it is important that the CDM team does this process. Okay. Now, the field details. Okay. Now, this is the form. You can see in a form here. And okay, now this case report form has these fields as I mentioned, right? So for the vital, the page is same. You see, all 8 pages or the 8 of columns has the same form, but the field is changing. Vital signs performed, yes or no? When did the patient has come? The time of the test, patient height, patient weight, body temperature, everything. Now, what is the format that they needed? Or what is the units? It's just asking yes or no. For that, you don't need any units. And drop down list. So there will be yes or no, for example. And yeah, see here. Okay. Now, the date of the visit. So the date of visit should be in this format, DD, HH, MYY. And you need any units for patient date of birth? No, you don't need units. There are no units at all. Okay. And for the month, they will use the drop down. Like whenever you try to select some month in any of the app, there will be drop down, right? Same way. You see that body temperature. So the units will be this one. And the drop down list. And for the date of birth, again, month. This is how. Right? So the specification will be written for every visit and every field will be given, and the frequency, the format that we are looking for. See that body temperature should be in 3 digits, minimum 2 digits. For example, as a systolic blood pressure 110, 115, or it can be 18, but it cannot be 10, or it cannot be 1, 2, 3, right? It will be in 2 digits. And diastolic will be in the other one. Then date of birth, the gender, ethnicity, everything. Now let's look at the visit calendar. See that every visit falling how many days? 7 days here. So first screening will be done for 28 days. So that means they will screen the patient for 28 days. Then every visit will be 7 days, 7 days, 7 days. 7 days gap between every visit. Now they're giving the dates also. So if they do beyond this date, before or after this test, then there will be an issue stating out of window visits and the event schedule. So now I have the field. What are the field which will be each page, and when this test will be done? I mean each visit and each is you see, right? I was telling you people this one. Huh? Yeah, here. Vital signs needs to be done visit one, same way here, event schedule. Okay, folder screen. And during the screening, the informed consent will be taken, eligibility will be taken, demographics will be collected, medical history will be collected, physical examination, lab TC, ECG, tumor assessment, everything. Number of forms folders will be 7 folders. Let's count it. 1, 2, 3, 4, 5, 6, 7. Okay. And 8. A tumor assessment. Okay. Which one? Yeah, this should be 8. Now, say, okay. Now, visit 2. What are the tests we are doing? We are not collecting inform. Can someone tell me why I'm not taking the informed consent on visit 2, visit 3, visit 4? Okay. Tell. Can some not okay? Yeah, maybe ICF will be collected during one visit, that is screening. But however, whenever there is amendment, whenever there is update in the clinical trial of the particular clinical trial, we will update the case in sorry, we'll update the ICF. But we don't know when we will update. That's why we will not expect anything visit, but it has to be done during first visit. Okay. And whatever the test that needs to be done during each visit will be calculated. This is how it is. Any questions here? Others, any questions? Okay. So if no questions, that's all from me, guys. Thank you so much. Have a nice rest of the day. Bye-bye.